Hello guys, welcome to part 4 of memory based questions, image based question with a meatal stenosis of infant penis. The answer was balanitis xerotica obliterans. Then ankylosis, spondylitis, investigation of choice is always MRI, not CT. Then 16 lining, 46-year-old female with high BP. Many of the options were endometrial biopsy or cardiology opinion for BP first. But I will say 170/100 is not a emergency. So if it is actively bleeding, that was given in the question, so endometrial biopsy should be done. Then penetrating wound with unstable patient, investigation of choice. So E-fast should not be done. The time should not be wasted for doing E-fast because it will take some time. Directly patient should be shifted to OT for exploratory laparotomy and attain hemostasis is the goal. Now patient on medication came with renal stones, like medication for BP, hypertension medication came with renal stones. What is the mechanism of action? So mechanism of action is increased calcium excretion that leads to renal stones. Now a 2-year-old choking with peanut injection, what should be done? This is highly confusing, but the answer is chest compression and not back thrust. Now POSCO, protection of children from sexual offenses. What is the age? 18 or 16. So females under 18 is given, and this is the correct answer. Father was ill. Doctors say he can't be recovered by further management, but doctor wants to keep the patient in ICU. What is this effect called? This is options were placebo or keep the patient. What is the correct option? So keep the patient and intubate the patient and keep the patient in ICU, not the placebo. Patient with dry eye, dry mouth, anti-joro, antibody is present, so that is Sjogren's syndrome. And lymphatic infiltration, the features they have asked, most important feature, that is destruction of the salivary glands, which leads to dry eye and dry mouth, and due to lymphatic infiltration, destruction of the salivary glands are present. This is the correct answer. Now immature teratoma, it is positive for. So immature teratoma is positive for CA125 marker. Now back marks and abrasions are present. So garroting is the correct answer, not throttling. This also had confusion among the ones, but garroting is the correct answer because back marks and abrasions are present on a body. Then breast CA screening, early detection, but increased mortality rate is not changed. What type of bias is this? So lead time bias, survival bias, or Parkinsonian bias. So in my opinion, it should be lead time bias, not survival and not Parkinsonian bias. Now footballer with foot eversion, what should be the damage? So deltoid ligament tear, no. ATF, that is anterior talofibular ligament injury. Yeah, this will be the answer. This is the correct answer. Component C5 C9 infection, it is most common one liner repeat question. Neisseria infection C5 to C9. Now febrile seizures, 6-year-old boy, the drug of choice is rectal diazepam. Rectal diazepam is the correct choice. Now manipulation, randomization, follow-up, statistical assessment sequences. So randomization will be first, after that manipulation, then assessment, and then follow-up. This is the correct sequence. Hurler syndrome deals with keratin and dermatan. This is the correct answer, keratin and dermatan. Now ART and ATT, that is antiretroviral therapy and anti-tubercular therapy, both regimes are needed to be given to one patient. Then what is the sequence of starting the drugs? So first ATT should be given. Later, after 2 weeks, ART should be given to the patient. Now B-palm regime, that is a new question I can say. They have included this time new modality, that is for TB. So what is the exclusion criteria? So miliary TB is excluded from B-palm regime. One numerical they have given 18 plus 7 minus bracket 27 plus x equal to 0. What is the value of x? If x will be minus 2, then 27 minus 2 will be solved first, then 25 minus that will be 25 equal to 0, so that x will be 0. And this is very easy, but lot of doubt is there in but plus 2 or minus 2, because they have said like this, but answer is x equal to minus 2. HIV, so prevent transmission of HIV to newborn. What is the regime if the mother has HIV infection? So nevirapine and zidovudine for 12 weeks is the current regime for prevention of transmission of HIV from a positive mother to newborn. This is the correct answer. Stay tuned. I will be posting more questions in a shorter duration of time. Thank you. If you have any doubt, you can comment below.